I don't see an end to this.
The war in Ukraine has been going on for over 2 months. Thousands have died and millions forced to leave their homes, creating a humanitarian crisis.
I felt that I had a moral obligation to provide whatever assistance I could. And now that our team's here on the ground, it's just so evident that our assistance is just desperately needed.
Winnipeg ER Dr. Tamara McColl has been assisting in humanitarian efforts in Ukraine. McColl says being in a war-torn country is an experience she has never been through before. And from a medical perspective, there's just so much her team and she have witnessed as they work to treat a variety of cases and injuries.
Ranging from pediatric medicine to wound infection, shrapnel injuries, other trauma, lots of psychological impacts of war, manifesting in kind of somatic complaints. So people coming in with concerns about, aches and pains and various other issues that really don't have any kind of medical or clinical reason for it, aside from the psychological impact of the war. And then a lot of chronic medical issues that have unfortunately gone untreated just because of lack of access to medications and physicians.
McColl is working with Canadian Medical Assistance Teams, or CMAT, a grassroots humanitarian relief organization. Valerie Repka, executive director of CMAT, says this is the first time they have been involved in war relief efforts. She says they have been consistently sending teams since the beginning of March.
We've sent close to 150 volunteers already, and we're dealing primarily with the refugees and internally displaced people that are coming from the eastern regions towards the west, towards Poland, and trying to cross the border into Poland, that need some of their healthcare needs looked after.
Repka says CMAT is fully booked with teams of volunteers until the end of June, but are looking into extending missions into the summer.
Part of our team stays at the border so that they can work in a clinic that's been retrofitted into a shipping container, and then the rest of the team does mobile medical clinics going to towns not too far from the border, dealing with the internally displaced people that are in shelters there.
McColl is Ukrainian herself, but she says that's not the only reason she feels it's extremely important for her to provide a helping hand to those who need it most.
This has just been an experience that my team members and myself, and we're just never going to forget it. And I think it's going to weigh pretty heavily on my heart for a long time.
In Winnipeg, Alex Karpa, City News.